Access to health records is a very serious problem for providers and their caretakers. Blue Button has solved this safety of life problem for millions of veterans, CMS and DoD beneficiaries, and their families. The Blue Button enables safe, secure, and reliable access to an individual's personal health record. And the first patient-facing deployment was announced by President Obama in August of 2010 in a speech to the disabled American veterans. 1 year later, then CMS Administrator Don Berwick said, "I am proud," whoops, you got this backwards? Said, "I am proud of the Blue Button initiative. It is an iconic, wonderful idea. The Blue Button isn't just valuable, it's magic. I want to get this right, that's why I'm reading it. It's the open sesame button that will open the door to a whole new level of care." Now, I was in the audience when he said this, and I had no idea that that was coming. So it was a pretty fun day for an applied mathematician and a former engineering professor. At the VA, we made a pledge to help people get their health data, starting with the simplest thing that we could think of, which was just an ASCII file. And by focusing on that outcome, just getting veterans their ASCII files, we developed a simple solution, and then we iterated on it based upon the feedback that we were getting from the veterans. Before Blue Button, sharing data between clinics, hospitals, pharmacies, labs was really complicated. You had paper records that you accumulate, in some cases in suitcases, or you had incompatible digital formats, which frankly still exist today, but Blue Button sort of transcends that idea. We're sort of take-all-comers approach. So today it's much easier to do that. Since the VA launched Blue Button, more than 500 companies have joined the effort and have pledged to make their health data available. In February of last year, the nation's leading pharmacies committed to making their customers' information available by Blue Button, thereby increasing its coverage to 150 million people, 1 out of 2 people in the United States, who will gain access to some piece of their personal health record through Blue Button. And the rest isn't available yet. There will be more payer announcements very soon, and this is going to push the number still higher. So why does this matter to any of you? Well, first, Blue Button is just one example of how a hell of a good idea with zero budget, but near perfect buy-in in the context of this conference, served the twin purpose of giant impact and easily replicable model. We didn't do anything special, it had huge leverage, and you can do it too. The program was a tactical success because it married critical services, obvious things like continuity of care. How do I get my immunization records from my pediatrician to my school? How do I get my pharmacy records from my primary care physician to the hospital? Obvious things like continuity of care to less obvious things like identity and access management to the lives of millions of people. Again, it's a safety of life application that gets a lot of attention. I'm sure you have a few yourself. The program is a strategic success because we found the right balance of muscular presidential authority and reserved sort of you take the credit partnership posturing between us, the VA, and other federal agencies, and of course, most importantly, the private sector. Nobody is confused about where Blue Button comes from, and nobody really cares. It just works. I spoke with Jen a few minutes ago. She and I have a common friend, Dmitry Kachayev, who co-founded Meter with me, and he has a more colorful way of saying this. She'll be laughing, I'm sure, when he says, stuff just works. So if your focus is on public health or in child protective services, by the way, congratulations to Kathleen Feely yesterday and her award for Case Commons. That's a fantastic thing. Then you should learn about Blue Button. All of the software is open source. It's easy to customize and easy to scale. If you're interested in transforming your state and municipal government, you definitely need to learn about Blue Button. It's a model, a template, and a pattern of what you can do to get people access to data, the people you work with, the people you serve, and have them do something with it. So a couple of months ago, Steve Andrus, Sonal Shah, and I wrote an article in Techonomy about the 5 principles of helping government do better with tech, I'm going to recite them very, very briefly. The most important thing, there's some pretty rote things that you can do, but the most important thing by far is to get the data out there. Don't worry about the format. Don't worry about the structure. Don't worry about what the downstream applications are going to look like. If you release the data, I'm going to do something with it. I promise. My business life depends on it. Make sure that you're iterating to the solutions. Don't think that you're going to get the right one the first time. In government, we focus a lot on process. There's a healthy reason for that, but we need to sort of raise the profile of outcomes. We want to iterate to getting the right regulations and attracting industry investment on the one hand, making sure that we're protecting personal health information on another. And last but not least, make it super easy for citizens to become engaged. So the challenge is not over. There's a lot of things that we can do to download the data. But these initiatives that follow those 5 principles, things like the industry-supported, I got to click here. There we go. The industry-supported GetMyHealthData.org initiative or the Code for America Vocatus project are empowering people with their health data and are just a first step towards engaging patients, engaging citizens, engaging people in their care process. Thank you very much.